All right, so this is our study plan. I decided not to put date on there because it creates a little bit of confusion. But then just make sure you are checking things off as we cover them. And don't forget that a lot of this content is also in Canvas. Not even a lot. All of these slides are in Canvas. I did my best to actually organize content according to this study schedule. But somehow when I try to rearrange it again, it kind of turned things around. So it's okay. The order of system does not matter. Doesn't make sense. You just have to understand and make sure everything is checked off. That's what's gonna matter. So Wednesday, question and answer breakdown, pediatrics, geriatrics, maternity. Key activities and guidelines, practice Q&A, reinforced content. What about Thursday, body systems, pediatrics, geriatrics, maternity, growth, milestones, immunization, falls, dementia, parental care. AAP, USPSTF, ACOR guidelines. What about Wednesday? Question and answer breakdown, pediatrics, geriatrics, and maternity. Review missed questions, reinforce weak areas. These are just things you can engage in, or a little bit of comment. Thursday, body systems, integumentary and musculoskeletal. Now, a lot of times it's not easy to cover all of these body systems, but we try to get as much as possible out of the way. So which means 2 systems at a time. A lot of times too, we don't cover all of the system. It carries over to the next time. Does it make sense? What are we supposed to focus on when it comes to integumentary and musculoskeletal? Eczema, psoriasis, fracture, arthritis, skin cancer, AAD, USPSTF, ACR, and ACR guidelines. What about Wednesday? Question and answer breakdown again. So question and answer breakdown, I'll explain what that is in a minute. Integumentary musculoskeletal system. You want to reinforce content and clarify doubt. Thursday, neurological and cardiovascular systems, which is almost unrealistic. But sometimes my cardiac is broken down and you see into multiple sessions, so that it's now just one day. Okay, so a lot of times I just leave neuro on one day, cardiac on the other day. Okay, so now what do we go over when it comes to neuro and cardiovascular systems? Stroke, seizures, arrhythmias, hypertension, heart failure, AACC, AAN guidelines. What about Wednesday? Neurological and cardiovascular systems, reinforce weak areas, summarize key points. What about Thursday? Respiratory and gastrointestinal system, asthma, COPD, pneumonia, GERD, PUD, LFTs, GINA guidelines. These are the supporting guidelines. I always say that for every body system, there is a guideline. Now, Wednesday, respiratory and gastrointestinal systems. Review challenging questions, reinforce content. Now, Thursday, genitourinary and endocrine systems. UTI, CKD, staging diabetes, thyroid disorders, IDSA, KDIGO, ADA, ATA guidelines. Wednesday, Q&A breakdown, genitourinary and endocrine systems. Clarify complex topics, reinforce content. Thursday, hematological, lymphatic, and immune systems. Anemia, coagulation disorders, lymphadenopathy, just some key areas we need to look into. Wednesday, hematological, lymphatic, or immune system. And then, of course, reinforced knowledge review notes and stuff. Thursday, reproductive and psychiatric and mental health systems. Contraception, depression, anxiety, bipolar. We will not go too deep, though, into special things like reproductive system or psychiatric, for example. We're just going to touch up enough to get through the exam. Does it make sense? But it's not a specialty exam. It's just an exam with that have to grab almost every part of the body system. And that is why it's called Family Nurse Practitioner. It's family. It's from babyhood to adulthood. So AGNP is mostly gero, but again, don't forget, it is what? A lot of body systems also that you're going to also see in family medicine. So it's the same content. The only thing is just that a lot more gero in gero. That's it. But believe it or not, we still do maternity in gero too. Some gero still, they still do things that regular younger people do. So we still have to treat the content that way. So don't focus on just gero and say, okay, let me just focus on gero. And even for my acute care students, the body system is still the same. Okay. So that is it for the introduction of the, syllabus. In case you're new and you're just coming in today. All right. Thank you so much. Speaking here is Dr. Kehinde Elisha, founder of NP Certification Academy, www.npcertificationacademy.com. All right. So now we went through the syllabus. Then what? You know what I'm saying? We went through the study guide or class study guide. Then what? So we always said, okay, we have 14 body systems. Okay. If we have 14 body systems, okay, let's go ahead and take a look at let me say, let's take a look at maybe cardiovascular system. Okay, so with cardiovascular system, okay, with cardiovascular system, we have so many disorders. Okay, so let's count the disorders. One of them is CHF. Okay, that's just one out of maybe 15. Okay, for this CHF, what are you supposed to know? You have to know what? How do you assess CHF? How do you diagnose CHF? If a patient has CHF, what plan are you going to have for them? After planning for the patient with CHF, how do you want to carry it out as the implementation? And eventually, what are you going to do about evaluating the patient? Okay. Now, each of this is also loaded though. When we talk about assessing somebody with CHF, now you're talking about scales. What scales do I need? Whenever I give medication to CHF patients, I'm going to assess the labs. Am I supposed to do labs before certain medications? Am I supposed to do labs during certain medications? Am I supposed to do labs after certain medications? We're supposed to look into that. So assessment is also loaded. When we're talking about titration too, it's also under assessment if you think about it. You see that your patient is experiencing some kind of side effect. How do you titrate up or titrate down this medication? What are you supposed to do about it? That is assessment alone, and it's not even finished. Now, what about diagnosis? With diagnosis, we're looking at the keywords. What keywords do I need to look for to diagnose CHF? What other disorders sound and look like CHF? That is what you're looking at. Does it make sense? Now, planning. If your assessment is now correct, let's put a little smiley face. Your plan is gonna be great too, because you start on the right foot. Because if your assessment is right, you're gonna be diagnosing correctly. If not, you're gonna be giving a wrong diagnosis. Then implementation is loaded. That is the pharmacology, pharmacokinetics, pharmacodynamics, pharmacogenomics, drug-drug interactions. Those all are here. Food-drug interactions, drug-disease interactions. And then you want to evaluate, go back to the top and check out what you've done, what worked and what didn't work. Listen, that is only one psychopathology though. And guess what? I mean, not psychopathology, excuse me. That's only one pathology, not psycho. Now, let me now tell you that under cardiovascular system alone, you have to know at least 10 diagnoses inside and out. And for those 10 diagnoses, I'm not trying to scare you. I'm just telling you what to, why you need at least 4 to 5 hours of studying a day to get through this test. Under the 10 diagnoses, we have to go back and do this all over again. Under every diagnosis, there is an ADPI process. Are you getting it? Please type yes in the chat if you understand what I'm talking about. Thank you so much. Total, we're supposed to know at least 100 to 140 diagnoses. 100 to 140, okay? Now, let's now shift gears after giving that one break, okay? The gear that I'm going to now shift is, okay, let's say we have 14 body systems. I'm going to just do something schematic here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay. Okay, so now that's that. So the first one, we have to know let me say 10 disorders. Just have this image. I'm not trying to scare you. Okay. I'm trying to let you know that it is nice to know, okay, this is Quizlet, this is what people say on the test, but it doesn't matter, like your content. I'm letting you know why I soak you in the content. Let's pretend that this is cardiac, this is respiratory, This is neuro. Okay. This is GI. Just write anything. This is, genital urinary. This is pediatrics. Let's just, come up with diagnosis here, okay? For each of them, let's come up, but this is body system. You have to know at least 10 diagnoses. Your diagnosis is your disorder, is your patho. Okay? You got to know your patho, period. We try to bring in patho every 2 weeks. We bring in patho to class. Okay? I think it's time for me to bring in patho today too. But look, for neuro, 10 disorders. I really hope you are catching this. Have this in your mind. Let me tell you, you are never going to be lost once you have the right GPS. I am giving you the GPS right now. This is Dr. Kehinde Elisha, founder of FNP Certification Academy. To reach us, nurse-to-nurse-coach@gmail.com or visit www.npcertificationacademy.com. All right? So that is that. Let me say we have all that now straight. For each disorders, we're now going to put an arrow forward here and draw our hard part. And draw our hard part. Okay, do you all see what I'm saying now? Do you get it? Okay, now tell me that this is 2 weeks is enough to know all of this. Even if you're a genius, 2 weeks is even plenty. Tell me that a 4-day review is enough for this. Even if you're a genius, it's not. Because I broke down earlier what contains that pie, or what that pie contains, what your D contains, what your P contains, what your I contains, what your E contains. I, broke it down. And in all of this, we also have to know our labs. Okay? Now, let me now tell you something that I do here. I will show you my schedule again and tell you what I have on top of it. On top of it, I have like prerequisites, prereqs kind of a thing. Like, I don't call it prereqs, I call it foundational course. The foundational things is going to be serology. It's going to be pharmacology. It's going to be pathophysiology. It's going to be, what else do I do as your foundation? A lot, okay? I expect, this one has been, I went over this already with most of my students, with some group of my students, and I recorded it. So I share this before my students even start class, or when they start class, I share this on day 1. So there is no time to do this if I have to do all of this in class. Do you see my point now? I can't be going through pharmacology in details. I can't be going through patho in details. Also assessment in details, I can't. But at this point, by the time you come to class, you would have this general idea first, and then I will now start applying it for you here. So you will do me a lot of good if you just listen and if you just take time and do the foundations. So if you're on WhatsApp, I'm going to repost those foundation videos now. They are directly stored in YouTube, but nobody have access. Doesn't make sense. So it is at the back end of my YouTube. Okay, so it's just a nice little storage because it never gets full. I will look for another platform to hopefully store these videos, but right now I will send it to students for students to please do it. If you have not been doing it, please do it. And we have so many successes the past month. I don't know if you realize that 4 students passed their board exam. That is huge. 2 ANCCs and 2 AANPs, and you will pass your test too. But you can't give up on the process. The journey is long. The process is tedious. People are passing. You will pass too. You have gone to school not to waste your degree. Many people come to me, Kehinde, I finished more than 3 years. I finished more than 10 years. Don't worry. Don't worry. Your time is now. Your time is now. Right? The time that you finish is past, is gone. Let it go. Now you're going to focus on here and now and focus on passing your test. All right? Well, I'm going to go ahead and get started with the business of today. The only thing I bring in on usually after 2 weeks, which is today now, is going to be what? Patho. Because some people don't do patho. If we don't have patho, none of this is possible. Can you see why my patho is important? because my patho is a foundation. Listen, my patho, okay, or the pathophysiology content is a foundation for your disorders. You have to know 140 disorders. I can bet it you can't get anywhere without your pathophysiology. All right. Dr. Kehinde Elisha speaking here. We're now going to get started with our content for today for FNP AGNP class. I really hope you understand the process. I'm also going to save this for you so you can listen to it over and over again to let you know your expectation and what you're about to go into. That is my contact right there, nurse-to-nurse-coach@gmail.com, www.npcertificationacademy.com. Thank you.